Hello everyone, my name is Selma Saber and today I'll be presenting my Project 3 research on how COVID-19 affected nurses' mental health, especially in terms of anxiety, PTSD, and burnout. During the COVID-19 pandemic, nurses all over the world faced extremely difficult working conditions. They took care of large numbers of patients, often without enough protective equipment, and were constantly exposed to danger. Many nurses were the only people patients saw because family were not allowed to visit. As a result, nurses didn't just face physical exhaustions, they also experienced serious emotional and physi- phy- physiological pressures, high mortality rates, long hours, and constant fear affected their mental health in ways that continue even now. Understanding this effect is important because nurses are the core of our healthcare system. When their mental health declines, patient care and hospital safety decline too. So, my research found that the COVID 19 pandemic had three major mental health effects on nurses: anxiety and depression, PTSD and long term stress, and the last, burnout caused by heavy workload and lack of institutional support. Today, I will focus on the effects I found most important and most alarming: burnout. The effect I want to focus on is burnout, which was one of the most widespread and damaging outcomes of the pandemic for nurses. According to research by Ojilo, nurses at Kenyatta National Hospital in Kenya experienced extreme physical and emotional exhaustions. Many worked long hours while caring of high numbers of COVID 19 patients. They also had limited PPE, which increased their fear of becoming infected or bringing the virus home to their families. One important thing I learned is that burnout wasn't just about being tired. It included emotional exhaustions and anxiety and depression and moral injury. Many nurses felt guilty when they couldn't give the patient the level of care they wanted because they were too overwhelmed. Loss of motivation and even though of leaving the profession. Nurses also witnessed frequent death among patients and even their coworker, which is added to the emotional strain. Even though some hospitals tried offering counseling, many nurses didn't use it because they worried about privacy or didn't have time to attend sessions. Burnout is important to highlight because it directly affects patient care. Research showed that high level of stress and exhaustions increase the risk of medical error and decrease job performance when nurses and mentally and emotionally overwhelmed, the entire health system became less effective. This research helped me understand how much pressure nurses face and how health system failed to fully protect them. It also showed that improving mental health supports providing adequate staffing, offering flexible schedule, and giving nurses access to counseling can help reduce burnout in the future. In conclusion, The COVID-19 pandemic deeply affected nurses' mental health. They faced high rates of anxiety, depression, PTSD, and severe burnout. My research showed that burnout was especially harmful because it affected nurses physically, mentally, and emotionally, and also impacted patient safety. Research proves that nurses need strong mental health resources, clear communication, and supportive working environments. If hospital and governments prioritize these things, nurses would be healthier, more than resilient, and better prepared for future health crises. Thank you for listening, and I'm happy to respond to your comments or questions. Thank you so much for your time.